my personal belief, and that's also the belief of our company, is that patient centricity starts with patient insights. And I have to explain you a little bit what that means, because that's a very simple statement. And I have to make a sidekick again, because I make a lot of side steps, because I like to increase the understanding. Here's how we learn. We learn at 3 different levels. Your children, you, all of us, we learn at 3 different levels. I think a lot of people in this room probably have children. Can I have a quick show of hands? Who has children? All right, so the vast majority. I'll use that as an example. When you were younger, much younger, you knew about children, right? You had read about them. You had seen them on television. They existed, right? And you could even read a book once you were about sure that you wanted them. And you could find out a lot of data about these funny creatures. And so you were learning at what is called the intellectual level. And that's fine. That's fine. But the next level is when you start seeing your friends getting children. It gets more real. You see the dark rows on their eyes. You see their social life being destroyed. But you also see the joy of them walking around with the kid and hugging it. This is the second level of experience called the related experience. But nothing comes as close as the third level, which is you actually holding your own child or staying up at night. And these 3 levels of, I didn't invent those, this is very old, it comes from India, Buddhist, it's 3,000 years old. These 3 levels of learning apply to everything. You can read a book about the Himalaya, you can talk to somebody who's been there, and you can actually climb a mountain. You can read a book about driving a car, you can sit in somebody's car, you can drive it. Anything you learn like that. That's very important to understand that. And it's the same thing in health and disease. It's the same thing. And why is this important? I'll give you an example. This is a typical medical intellectual presentation. As you can see here, the subject is lying on their left side because they have a broken rib. As you can see up there, it's about rib number 7. So the subject probably had a blunt trauma. The prognosis is extremely good. Complication rate is low. It includes hemothorax and a few other things. But all you need to do is give them enough pain so they don't stop breathing. Apart from that, it's very simple. Next patient. The problem is, 3.5 weeks ago, I was that patient. To be fashionable these days, you need a skiing accident, so I arranged one. And I broke 2 ribs. And I can tell you that the difference between the intellectual and related, intellectual, what I learned as a doctor about rib fractures, related from having treated some patients, and the actual experience is day and night. And the medical thing didn't help me very much. It really didn't, because it didn't tell me how to get in bed, out of bed, turn in bed, how to go to the toilet, how to put on my shoes, and what to do. And all that really helped me, I got from other people who actually had gone through it. First friend I called said, drink. And I said, drink? What do you mean? He says, the last thing you want is constipation. I haven't thought about that. It's not in the course of medicine. It's true. And there were lots of practical things like that. And what I'm trying to show you with this example, this is a benign medical condition in medical terms. It's not benign when you lie there and you can't breathe. But just think of the chronic diseases you're treating. They're so much more serious than a rib fracture. There's a canyon of difference between the levels of learning. The intellectual level is the statistics of your disease. It's what policymakers make. It is what your own board uses to approve your plans. It's purely intellectual. And here's the big thing. I've been working in medical affairs for 25 years, and that was the closest we got to the patient. But the doctors are only at level 2 because they don't have the disease. And that means that if we've been spending the last decades talking to doctors only, we've missed the most impactful and insightful experience of the disease. And that and nothing else is the reason why we need to talk directly to patients. And at this point, I want to make the remark, not to patient organizations, because very frequently they're not led by patients, but by partners of or people who are doing it as a career. I'm not saying you should only talk to patients, don't get me wrong, because my rib fracture is probably not your rib fracture. But you should talk to a few of them, and I think you need all 3 levels. Good. So, then how do you do that? The important thing is you go and sit next to a patient, unless you can get the disease yourself, there's no way, right? But you sit to the patient and you become yourself at level 2, you become a direct observer. and you observe. And there are many companies these days that specialize in actually observing patients. Wonderful example was somebody who just taped one of those skiing helmet video cameras on their head and admitted themselves to an emergency ward and just looked around. It's a wonderful video on YouTube. It took 20 minutes for the first healthcare professional to say, what is that on your head? It's amazing what you can just learn by observation. But it's very important to not mix observations with insights. That's very different, and I will explain you what the difference is. The insights may come later, and they will be internally to your company. I think sooner, with digital media, we will all have the same observations because we'll all be able to tap into global databases that tell us about data and statistics. But it is what you do in your company, the links between this observation, that are the insights, and that is difficult. Now, observation itself is difficult, and I could spend my time, but my time is really running out. I'm going to have to rush. Insights about connecting, and the big difference is this. Observations is looking at the what. What is a patient doing? How is he opening the box? How is he swallowing my patient? But the insight is the why, and that's why we need insights. Now, how you need to do it, I'll quickly go through it. It's quite important that you fix this, because if you're going to tell your company employees, all of them, to engage with patients, you want to make sure that you don't run yourself into compliance problems. The 3 categories, the associations, there's specific legislation for that, groups of patients, and the individual patient. And I would really urge you to work on the individual patient with your compliance team and set up a company-wide way of doing that. Of course, I can't share that because that's proprietary, but we've put a lot of effort in that, and we now have a very clear system whereby everybody in the company is encouraged to go and see a patient and knows how to, which forms to fill, which reports to do, etc., to do it compliantly. It's very important. Now, important when you talk with patients is always these things. Start with the basics, which is respect, which is confidentiality, which is reporting adverse event. It doesn't change. But you also never can forget who you're talking to and who it is. It's patients. I have known patients to be invited to executive meetings because the executive people wanted to know, and they push the patients through the executive schedule, which is, first of all, bladder training, and secondly, a brain training. Most patients with a chronic disease cannot, simply physically cannot, live their life at the same pace as we run our meetings. So you have to make sure they can go and rest somewhere, they can step in, step out, and don't make them sit into meetings for 3 hours and stuff like that. It sounds trivial, but it is really very important. Also make very big difference between planned and unplanned, because unplanned engagement with patients have different compliance dimensions. Active or passive, whether you're engaging or not, and last but not least, whether you want to keep the patient anonymous or not, because once you want to share their data, you need all kinds of approvals. 2 things to remember. There's the process journey. What I would recommend you is take any process in your company, all right? Devising a protocol, for example, for a study, or setting up a marketing detail piece. You map it out over time, visually. You have a meeting inside with your people and say, when should we have patients' input? You take away the dots, you go with that same chart to a group of patients and have them put the dots when they feel they should give input, all right? And then you put all the dots there where there is concordance, you just build it into your process. When there's a difference, you get a wonderful discussion. And you will find out you don't need patient input the whole time. There are decisive points in the creation of a detail piece, in the creation of a protocol where you need it. So that's the process journey. Also important is the patient journey, is to truly understand. And I'm not meaning the patient treatment flow, which was what we've done in pharma. Pre-diagnosis, diagnosis, monotherapy, bitherapy. I mean, how is the patient living that at the different stages? What is the emotional engagement? What is the experience? Those are the 2 journeys you should focus on. I'll jump this one. And then who should do it? Frankly, it's like the Cleveland Clinic. It's every employee. Also make sure that your vendors, if you work with vendors to work for you to develop your studies or your promotional material, make sure they get your philosophy and they abide by it. And every stakeholder you work. So it's going to be everybody. So last slide as promised. My take-home message. First, the 5 E's. 5 E's, remember, for the engagement and so. The golden rule. And that train's left the station, so you're either on it or not. And if not, you're going to have to get on one of these little things that move you forward along the track. There's a process. Don't panic about it. It's all about patient insights in the first place. And then turning those into solutions is where you add your IP, your intellectual property. The better you are at that, starting from the same observations, the difference it will. Everybody had the same problems. It's only Jobs who gave us the iPad, right? Everybody had the same problems with their horses. It's only Ford who invented the car. And then nobody's exempted from this. With this, thank you and sorry for running over.